Hello, welcome back to Famhealth. Today we have a very interesting series starting called Mission Digital Heart and Vascular Health. And we're doing it with none other than our advisor, Dr. K Chopra. Dr. K Chopra, as many of you would already be aware, is already working with Medanta Moolchand Medicity for a long time. He's a senior cardiologist there and chairman CME at the same hospital. Not only is he a president with various organizations, he's been the country head of EHA, he's the president of World Heart Academy, World Wellness Foundation. But, I'm super proud to announce that very recently, Dr. Chopra has received an award of brilliance of national importance. He's recently got the National Award through Science and Technology Legal Communications, MST, DST, Government of India. Without further ado, Dr. Chopra, please help us start on this theme. Tell us a little more about this award that you received. It's for academic brilliance, we're told. So I'm sure our viewers would want to know a little more about that. And not just that, but just after that, please, I give you the stage. Let's talk about heart and vascular health and life after COVID, which is the most important subject that we are concerned with right now. Over to you, sir.
Thank you very much, Ashaji. It's really a great pleasure and honor indeed for me to be here today on the platform of Tata Play Famhealth on a very special occasion, which you already announced, which is going to be launched today. And the occasion is Mission Digital Heart and Vascular Health, which is the need of the hour, not only in India, but also in the globe. Ashaji, you just wanted to know what was my recent achievement as a national award before I really start my presentation on what topic you're given to me, life after COVID, especially heart and vascular health. On 28th of February, on the occasion of National Science Day, which was organized by Ministry of Science and Technology, Department of Science and Technology, and Ministry of Culture at Vigyan Bhavan. I'm very fortunate that they conferred a national award for outstanding scientific and technological communication in the most popular focused books of cardiology, magazines, and journals from India to the world. I'm really humbled. We have our Minister of State, Minister of Science and Technology, and he was personally there, Dr. Jitendra Singh, and he conferred this prestigious recognition, for which I'm very humbled and honored. And it really inspires me to work more and more in the rest of my life. With these few words, ladies and gentlemen, I must compliment Asha, who has been behind me for last almost 2.5 to 3 years, that a time has come we should talk of digital health to promote health globally, not only in the urban area, but also in semi-urban area and the rural area. Our reach can be enormous. So digital technology is going to be the real pathway of promoting health and promoting diseases. So I think the topic given to me is life after COVID. The scenario of COVID is very well known to you. I will just highlight, and I must mention very clearly, ladies and gentlemen, I am not a virologist. I am a cardiologist. But I have a deep interest in the clinical presentation and management of COVID pandemic. because it affects cardiovascular system very extensively. And I have a huge data and huge experience of last 2.5 years, which I would like to share in the next few minutes. I handled many patients and I'll give you some insights as to what we should do so that we can handle the heart and vascular health very meticulously and maintain the integrity of various components of heart and vascular health at least till the age of 90. After 90, everything has to wither. We know it. COVID-19, you all know, was originated in December from Wuhan and disseminated in the whole world like a fire. It was like a global tsunami with a very high heart and vascular morbidity and mortality. We had come to know little late. The first study which was published from Italy has shown post-mortem data that most of the victims who died because of COVID had multiple clots in their vascular system. The same thing was mentioned in one of the journals from China too. At that time, we were not aware as what is the natural history of this particular virus. We have seen so many viruses in our life, smallpox, polio, and even swine flu virus. They have only the inflammatory component. It is this virus which is not only inflammatory, but also prothrombotic. Prothrombotic means clot forming virus and pro-immunogenic. That is the character of this particular virus, which makes it relatively dangerous as compared to other viruses like a flu virus or other viruses which I just mentioned to you. And you all know it. We had no treatment of smallpox. You also know we had no treatment of polio. How did we win the battle? We won the battle because we had a very effective vaccination program. The same thing is happening here. I'll come to you in the next few minutes. You all know the total number of COVID cases in the world today are 43 crores. What is the mortality? The mortality is 1.4%. Global mortality. Now, if you see the data of India, there are 44.3 crores of patients of COVID are in India, which is 10% of the global data. 10%. But the mortality is less than the globe, which is only 1.8% or 1.18% to be precise, which is less than the global mortality, for which we should be very proud. I think our system, under the dynamic leadership of our Prime Minister, Shri Narendra Modi, was superb from the beginning. A meticulous approach was implemented in the COVID care right from the beginning in the form of universal precautions, and then various drugs came in vogue, and then came the vaccination drive. I must compliment ICMR, WHO, and Ministry of Health, which has really effectively helped us to reduce our morbidity and mortality. As I already mentioned to you, the nature of the virus, we should be all the time keeping in mind that this may cause inflammation, it may cause clotting, and it may cause immunogenic resetting. So our objective is, if we already have a tendency for clotting, means if you are beyond 55, we must take blood thinners.
Sir, can I ask you a question at this juncture? Is there a big impact that you're seeing even after the Omicron wave?
Yeah, I'll just come to it because you will just see that how the things evolved. When we were seeing the patients who were just bumping in the emergency, one after the other, and we didn't know how to treat. That was the irony. We didn't know how to diagnose them. That was another irony.
That was
And,
the
and
first.
we didn't know how to even investigate, how to make the severity of how to classify the severity of this COVID.
Mhm.
I think we were totally in dilemma in the beginning. So natural history of this virus was not known to anybody in the world. It
True.
just came by surprise. Now, how did we diagnose? We took some time, but the diagnostic modalities of tests were divided into four components. The first was RT-PCR, which was very sensitive and specific. And nowadays, we do what is known as CBNet. CBNet is a quick RT-PCR. We get the report in just 45 minutes. And then, of course, rapid antigen test, but the sensitivity and the specificity is low. If it is positive, it's well and good. If it is negative, it does not rule out COVID. Then come the inflammatory markers, by which we could say that this patient is mild, moderate, severe, or critical, depending on the CRP levels, interleukin 6 levels, and ferritin levels, because they are the inflammatory markers. Then comes the thrombotic marker, and that was D-dimer. And the severity was also depending on the level of the D-dimer, as mild, moderate, severe, and critical. This was a real development in the natural history of evaluating the virus severity in our clinical setup. The best modality of imaging was not known to us. Is it ECG, is it tropi, or is it echo, or is it HRCT? But ladies and gentlemen, I must tell you today, the best modality was CT scan, HRCT. Because the various segments of lungs which were affected, we could easily evaluate in great details, and we also established a scoring system there, what is known as CT score, less than 9, 9 to 14, 14 to 19, 20, and then people having 21 to 25, they were labeled as critical COVID. This also we learned. We are all in the learning curve. We were not aware of anything. And then came echo. Echo and vascular modality was of a tremendous help to understand the structural, functional, and the flow profile abnormality which are caused by the COVID virus. I think they were very, very important. And we also came to know that this virus definitely caused clotting. I just narrated one case. I think this was only 15 days of my experience. A chartered accountant called me, a 32-year-old, that he had a chest discomfort and a little feeling of giddiness. And I sent him to the hospital. His CT was done. He had a small, tiny infarct in the brain, what we call as a brain attack. We did his ECG and we found he had a heart attack together. And the cause was COVID. First case of my life who came with 2 attacks at the same time, COVID infected in a young guy with no comorbidity. That is what COVID is all about. And then the simple thing which we came to know is we should do SpO2, a very bedside marker by which you can see the oxygen saturation and classify the severity, mild, moderate, or severe. But if it is less than 90, we used to hospitalize the patient. We also can see the heart rate. If the heart rate is more than 120, it gives a red signal. If the respiratory rate is more than 30, red signal for hospitalization. So see the clinical marker. So we had clinical markers, we have inflammatory markers, we had thrombotic markers, and we had imaging markers. So we achieved perfection in the clinical management over a period of time. Then comes genetic sequencing. See the development, how it progressed. Genetic sequencing played a very, very important role to assess the various mutations because the virus were going very fast. And I think Ashari just asked me as to what are these various mutations like alpha, beta, gamma, delta, and then Omicron. And again, Omicron is BA1, BA2, and so many variants are there now in the whole world. And I think these viruses mutation vary in the severity of virulence and transmissibility potential. When Delta virus came, the second wave, that was the most deleterious. It was like a horror. A lot of young people fell victim to Delta virus and passed away. And this virus has a very high mortality, irrespective of age, sex, comorbidities, or no comorbidity. So that was a very highly virulent virus, second wave. Third wave we have was Omicron virus. And we thought it's a very mild virus, but it is not mild. Even the Omicron virus is mild, low virulent, but the transmissibility is very high. And we had seen a lot of patients who were beyond 70 and 80, they also passed away because they were high morbidity and more thrombosis. So all the individuals who are beyond 70, 75, the mortality of Omicron infected is also relatively high. We should not underestimate it. That's a very important message. And the Omicron virus has a very high transmissibility. So that was a very, very marked potential of this virus, but definitely less virulent. 90% of patients were treated at home and they had no residual effect. Now, the topic given to me by Ashaji is life after COVID. What happens to the heart and vascular bed? Up till now, we're focusing on heart, and now we are diversified to focus more on the vascular bed also. I would just like to clarify before I speak further. Ladies and gentlemen, we have 60 trillion cells in our body. And there are 6 trillion chemical reactions occurring every second right now in you and me with 60 neuropeptides. How do they work? How you make the cells function? It is only because of the blood supply. Where does the blood supply come from? The blood supply comes from by contraction of the heart. But can the heart send the blood directly to cells? No. There are vessels. There are 60,000 miles of blood vessels in every human being, supplying the blood from heart to the various cells and tissues and organs of the body. And there are 6 billion capillaries, tiny vessels like a hair from where the blood flows. And they have endothelium. This get affected when there is a virus, COVID virus attacking the human being. That was a real challenge for all of us. So when we talk of any injury or any damage in any organ, it was vascular inflicted. Very important message. That's why I say vascular health is of a great understanding for which we have launched this digital heart and vascular mission, so that everybody understands the vascular health is same as the heart health. Its importance should not be underestimated. Now, how it affects the blood vessels and various organs? Now, take for example the heart. You all know it. A lot of patients had a heart attack following COVID, especially those who are beyond 50 or 55, or those who are young but they have comorbidities. I've seen one of my very young friend's son, who was just in 40s, who came with a clot in the leg veins, had a pulmonary embolism, means clot in the lungs, and had simultaneously a heart attack, and we lost him. He had a liver injury also. So in the heart, it may cause palpitation, it may cause arrhythmias, fast heart rate, or even a heart block, or a heart attack, or even heart failure. I saw the other day a lady who came to me 3 months after the COVID, has got cardiomyopathy. And all the filling pressures were high when we checked by echo. And we are treating her, and I'm sure we'll be able to help her out. And certain cardiac deaths are also known. We have seen in our emergency a lot of young, especially with Delta virus, had the sudden cardiac death. Lung, How does it affect the lung? Not only pneumonia. We misunderstood it. It's not only pneumonia. Viral pneumonia is minuscule. It affects angiotensin receptor system and cause some kind of cytokine storm. Again, lead to clotting. The whole lung is web of blood vessels, just like a ramification or roots of a tree, and they get what we call pulmonary embolism. Microembolism, submassive embolism, or a massive embolism, what we call as lung attack. This has all been proved by post-mortem data. In the brain, it may cause brain attack. I already given you an example of my chartered accountant. It may also cause cognitive disorder, especially in elderly patients. They may become more forgetful. So we need to enhance the flow of the brain by whatever methods we'll discuss in the next few minutes, and anxiety disorders. So a lot of psychosomatic problems we are seeing, people who suffered from COVID. How we should manage them, what we should do, I think is a very important point which we are going to discuss. What happens to the legs? People may get leg attack, clotting in the legs, veins, capillaries, arterioles, large vessels or small vessels. So one should make sure that we have adequate flow of the blood vessels maintained. I always say, use it or lose it. Move it or lose it. You have to keep on moving our body all the time. Even if you're suffering from COVID, don't confine to bed until unless the doctor says so. You're in severe COVID or a critical COVID. But when you are in mild or moderate COVID, you have to keep on be active. Eyes, I've seen patient having an eye attack. There is a thrombosis. A person called me from Pune who developed sudden blindness, and the cause was central retinal artery occlusion after COVID. He recovered over a period of time because they gave him a lot of steroids and other blood thinners. Ear attack, sudden deafness, again because there is a vessel blood supply. They're tiny, tiny vessels which supply blood to the ear. Very rare, but it happened. It has been documented in the world literature. And very important thing I want to tell you, I just saw a lady, I lost her, who was my patient for 44 years, 83-year-old. She came to me with a skin lesion, what we call a cellulitis of the abdomen. And we label this as cutaneous necrotizing vasculitis. The cause was she suffered from COVID, so-called Omicron virus.
Oh dear.
And we lost her because she had a septicemia and a fungal infection subsequently. So it is a vascular insufficiency which causes this. Now, how does it affect the abdomen? It may affect damaged liver, kidney, intestine, and inflammation. All I've seen. One of my very close friends from Sundarnagar, he had a perforation of stomach, esophagus, intestine, because he came 3 days later to us. And by the time he came, he had a ischemic damage to the intestine, and on the top of it, he developed so-called black fungus or a white fungus, and ultimately we lost him. We used to walk together in Lodi Garden. So that is the misery which we've seen with Delta virus. I think we took some time to understand it, but now we are very wise, and we are going to make the challenges in the future, deal with them very meticulously. Now, what happens to the blood? Very important. One of my very close friend, where we worked together for 25 years, he developed what we call a DIC. DIC means disseminated intravascular coagulation, where the D-dimer levels are very high.
Okay.
His D-dimer levels were more than 30,000. And we have no treatment to offer to such patients. And he also had some comorbidities. So more the comorbidities, more is the mortality. And less are the comorbidities, less is the mortality. So our objective is, please take care of heart and vascular health, whether COVID or no COVID. And be more careful after you have COVID.
In fact, at this juncture, I want to tell our viewers, Dr. Chopra, with you, we've got so many missions that we've been launching for the last few years. In case you want to hear about how to manage your heart health, you want to know a little more about vascular health, please log on to famhealth.in. You can in fact see all the videos that we've done to that effect. You can read some articles as well. So it's very important, and that was very critical information. Sorry, back to you.
Thank you, Ashaji. I think it is very important. And now comes, we know the clinical spectrum, we know the diagnostic methods, we know the various kind of immunological tests, and we also know the imaging technology, and we know how dangerous this COVID virus is as compared to other viruses. Now, what is the treatment? They also were confused. We thought of hydroxychloroquine and so many things initially.
Correct. And we've done
But
so
the
many shows
answer,
with.
but the treatment is very clear. It's a it's a great matter of concern for us. There is no specific treatment of COVID virus till date. This is a very clear message. The only thing which helped in some patients were monoclonal antibodies. And there is a data to support my statement, what I'm saying, that monoclonal antibody decrease hospitalization, decrease severity of COVID, decrease admissions in ICU, decrease the need of ventilator, and prevent death. So why not to give monoclonal antibody? No side effect, very safe. What is the confusion? There should not be any ambiguity in starting monoclonal antibodies. I have given to a lot of my patients, and the salvage rate is very high. But some people who had very severe comorbidities, despite monoclonal antibodies, we could not save them. So there is, of course, limitations. We have to understand that, but the potential also should not be ill understood, misunderstood, or underestimated. The next thing is blood thinners. Role of enoxaparin or heparin or rivaroxaban are also known to prevent thrombosis and treat thrombosis in a protocolized manner. Please go to a specialist and get your treatment done in a very nice manner in the beginning, so that you don't fall victim to vascular insufficiency after COVID. Vascular health is very important. If we do it in a protocolized manner, then we will not have any problem. What is the role of vitamin C, vitamin D, and zinc? No mortality benefit. It is only immunoboosters. So immunobooster can be continued as an anti-inflammatory potential, no harm. What is the role of paracetamol? We use so much crocin or dolo, it is just to suppress the temperature. That's it. But there is definitely a role of oxygen therapy, where the oxygen concentration is less. There is definitely a role of ventilative support if required. Role of steroids only for emergency. We should not use indiscriminately steroids. That makes them more vulnerable to get secondary infection, like fungal infection, like black fungus or white fungus or whatever, a mucormycosis. Role of remdesivir, zero. No mortality benefit. And role of plasma therapy, no role. So, ladies and gentlemen, I cleared all the concepts that how we should treat our patients. There is no specific treatment of COVID till date. Now you can ask me, sir, how will they reduce the mortality in India to such a lower level as compared to the globe? The answer is, thanks to our Prime Minister, our Ministry and ICMR for early implementation of vaccine drive. So India is a vaccination superpower in the globe. Not only supplied to India, but also in the whole globe. So vaccination is the answer which really helped reducing morbidity and mortality in our country. Now, I just like to mention 10 more important points today, because we are talking of life after COVID. And what are the 10 points? They are known as appropriate COVID lifestyle behavior, 10 S to be remembered. What are these 10 S? Besides the universal precautions, which we're talking for last 2 years, like social distancing, face masking, frequent hand washing, and respiratory hygiene. The first S is very important. Stress management. Don't get panic. Don't make this pandemic as a fear pandemic or a chaotic pandemic or a confusion pandemic or an anxiety pandemic. Because by becoming more anxious, you liberate some jittery molecules in your system, what we call epinephrine and norepinephrine and steroids, which further reduce your immunity. And you get malignant form of COVID. Be calm and face it and treat it to the best of your capability with the help of a specialist. Early treatment. Number two is sedentary lifestyle. Please, I use the word move it or lose it. All the time remain in motion when you are mild or moderate COVID. Keep on doing your activities, whatever you are doing. Don't be confined to bed. And number three, self-hydration. Adequate amount of fluids, at least not less than 2 liters, until unless it is contraindicated. For example, if you have a CKD or you had a heart failure, please take the help of a doctor. But if you are young, self-hydration is a need of the hour. Most of the people in India are dehydrated. They don't consume much water. And that's how they get more clotting formation. It has been reported in one of the study from Raipur that in summer, there is a higher prevalence of heart attack because people are mostly dehydrated. It's severely hot. So that may cause clot formation. Number four is also as smoking. Please stop smoking. If you are smoking, if you are a smoker, stop it today. Otherwise, you will definitely fall victim to a vascular insufficiency any time in your lifetime with COVID or without COVID. The vascular insult take place in the small capillaries and arterioles and big arteries and may produce heart attack and lung attack and brain attack and every attack possible. So please condemn the use of smoking. There is not a single benefit. Today we smoke a cigarette, tomorrow cigarette will smoke. Today you chew a tobacco, tomorrow tobacco will chew. I always say smoking cigarette means climbing a slippery slope. You have to slip. The question is some little early, some little late. It's a slow motion suicide and a slow motion poison. Please quit smoking now before it's too late. Fifth, saturated fat. The people who take saturated fat, they are more vulnerable to clot formation. Their cholesterol get oxidized, LDL, and it causes injury in the endothelium and make it rough. So more clot formation takes place. Sixth, salt consumption should be less because this virus affect angiotensin converting enzyme, which are distributed in our system. So people who have a high cholesterol or hypertension, they have more comorbidities with this virus. So our objective is, if you are on ARBs, continue ARBs. It mitigates the severity of the COVID. Similarly, if you are on statins, continue statins. It also mitigates the severity by anti-inflammatory action. And if you are on anticoagulants or antiplatelets after angioplasty or after bypass or after having a heart attack, or you have some risk factors after the age of 55, please continue antiplatelet drugs. Don't stop it. Otherwise, you may get a clot tendency and you fall victim to vascular insult or vascular insufficiency. Seventh is sleep. Please sleep 6 to 8 hours. It looks very simple, but what I am talking, there is a lot of in-depth science in it. And if you sleep adequately, your biochemistry is well maintained and your vulnerability for clot formation and inflammation is also reduced. Then have sattvic lifestyle. When I say sattvic, don't keep on consuming chicken and meat and eggs multiple times thinking you'll get strength. That's a misconception. Sattvic life means practice all the 8 limbs of yoga. Yama, Niyama, Asana, Pranayam, Pratyahara, Dharana, Dhyana, and Samadhi. In other words, moderation is the key. balance your lifestyle. That is an appropriate COVID behavior after COVID and meeting the future challenges in the years to come. And please follow important vaccination protocol as recommended by ICMR or Ministry of Health or WHO. Don't be scared of vaccination. It is going to give you life. So I think we have to understand that, and there should not be any confusion about it. Ninth S is self-consumption of immunoboosters. You should know India is the world capital of omega-3 fatty acid deficiency. World capital. And omega-3, if deficient, you are more prone to inflammation. So you must consume omega-3 fatty acids and take zinc, vitamin C, and vitamin D on a regular basis. It's a normal requirement. So you should take additional pills. You need to have vitamins to maintain your health. So this concept is coming only after COVID. So we're becoming more wiser that we need to consume vitamins and omega-3 fatty acids, which is very, very important. And last but not the least, self-understanding of the need of vaccinations, which is the most powerful tool and protocol as per the guidelines of various organizations like CDC from USA, ICMR from India, WHO from the world, and Ministry of Health from every country. We should follow their protocols. They are going to eradicate COVID from our planet the way smallpox has been eradicated, the way polio. They are viruses. They have been eradicated. I also feel, and from this platform of Tata Play Famhealth, I must compliment Asha here. I don't know how she got the idea to initiate Famhealth, which has gone to such a huge visibility all over the world, talking of health 24 hours in a day. I think she really worked very hard. I must compliment, and the various ministries should take a note of it. That we must launch.
All thanks to you. Thank you very much.
We must launch various apps from this platform in public interest. And I will appeal to everybody from this platform today that we must act locally and impact globally. Here is the platform. Tata Play Famhealth or Famhealth. Same thing from my point of view. We must inform, perform, reform, and transform the whole world as COVID-free from a platform of Famhealth is possible. If you think it's possible, we must launch apps on heart and vascular health after COVID in public interest.
Yes.
I'm sure I will do it with the help of Asha. And second thing, I also like to appeal here through this platform of Famhealth that there should be special post-COVID heart and vascular healthcare clinics. As I mentioned to you, every organ in our body, right from the brain, heart, lungs, liver, kidney, legs, skin, everything is affected, including ear, eyes, and nose. What is the cause? Vascular problem. So we took time to understand it. And that's how we launched.
Brilliant idea, sir. That's a very, very important.
Digital heart and vascular health. And I'm sure with the help of Asha ji, I'll try to launch many such programs in the years to come so that there is more viewership, more visibility, and we fulfill the dream of Ministry of Science and Technology, digital health for all. That is the only way. Digital technology is the only way. In last, ladies and gentlemen, I always believe in spirituality as a scientist. I think everything helps when we go wrong somewhere in the nature. So my expressions are like this. And this is a quantum mechanical body, which is very important if you understand it. If you don't understand it, it has no meaning. As is the quantum soup, so is the quartz, the tiniest particle. And as is the quartz, so is the boson. And as is the boson, so are the protons, neutrons, and electrons in you and me. And as are these protons, neutrons, and electrons, so is the DNA. The DNA in me and DNA in you and the DNA in virus are almost same. They are very tricky. They have intelligence. That's why they multiply mutations. So if our intelligence is more than the virus, we can fight this battle. And as the intelligence, so are our choices. And as is the choice, so is the mind. And as is the mind, so is the body. And as are the mind and body, so are the COVID behavior appropriation in the lifestyle. And as the COVID behavior in the lifestyle, so is our heart and vascular health and immunity. And as are the heart and vascular health and immunity, so will be the world around you. Where does it originate?
Brilliant.
Just think about it. Introspect. That we have to work from the level of consciousness. I remember the words of Albert Einstein, the great physicist, who once said, "We are not packages of flesh and bone, which we think. We are all the web of information and intelligence interwoven with the emotions and energy from the level of consciousness." So I am telling you today from this platform that we are not only what Albert Einstein said, we are also a web of blood vessels right from head to the toe. Tiny capillaries to arterioles to venules to larger blood vessels and then aorta, and the flow which is happening all the time. And there should be a synchrony between the flow of what we call as potential energy of the heart and the kinetic energy of the flow. Who will maintain this? You and me. If we optimize our lifestyle from beginning, we can easily face the challenge of COVID in the future. But the message should be very clear. Vaccination protocol and herd immunity are the answer to get rid of this COVID virus from the whole planet. I must compliment Asha ji helping me to launch this special mission and the mission of heart and vascular health in the years to come. And life after COVID purely depends on heart and vascular health. Thank you very much for giving me this opportunity.
Thank you very much, Dr. Chopra. Just a couple of points I must highlight. Now that we've been working together and you've been guiding us so beautifully for so long. Number one, when you talk about spirituality, you are a very rare doctor, in my view, who actually follows it. So, the fact that you follow the Gita, the fact that that's your guiding principle is amazing. So I must compliment you. It helps me stabilize. So if anybody wants to do de-stressing sessions with Dr. Chopra, I think we should be organizing it. That's really brilliant. And you're right. The digital, in fact, the more one thinks about it, the world needs help. So why just limit it to India? It should actually reach out to the world. There are so many countries that we're helping with for food, etc., etc. I think health education is so critical, and health education from verified sources, put in small, simple, easy to follow language is so critical. So I think, sir, under your guidance, we should lead the way.
Thank you. I think, Asha ji, I totally agree with you. A time has come that we should have a paradigm shift.
Yes.
The paradigm shift should be digital health for all in the years to come. It's possible. It's possible, not probable. So the possibility should be in reality, and we all need to work together, help together to go to masses, so that India should not be called as the world of illness. It should be called as world of wellness. And we should have this challenge that we should become the global leader of digital health. I'm sure, Ashaji, you will help all of us and our initiatives so that we go digitally all over the world very soon. By the year 2023, we become the world capital of digital health.
Yes, the fountain of knowledge. Thank you so very, very much, sir.
Thank you very
Thank
much.
you for this conversation. As always, it was very significant, very meaningful, and very, very helpful. I'm sure our viewers would appreciate it. Thank you.
Thank
Please
you.
stay tuned on famil.in, and we'll have more such conversations and get our questions answered. Thank you, Dr. Chopra.
Thank you very much. Thanks.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।